wouldn't even have imagined 10, 20 years ago.
Absolutely right.
What else do you see us being awed by in the next few years?
Well, continuing the same vein, the robots are going to change over a period of time. You'll probably find them dropping from the ceiling and kept in the ceiling otherwise. There's a button that got drop down, the arms are there, do the surgery and go back into the ceiling instead of occupying so much space in the operation theatre.
I see.
Right
so
now
space is a challenge.
Oh yes, it's a clutter with the body, huge body standing there, console there, patient cart on the other side. Poor anesthetist is to be locked in one corner. But in the future, the thing arm might just drop down from the top, remove the offending object and go back up. So that's something that's in the future.
I'll also mention something that I saw when I was in one of my trips to some of the hospitals, and I think it was also the Apollo hospitals. They've introduced a HIFU procedure which takes care of women's fibroids without any incision being made. So they use laser beams to shrink the fibroids, and with that a woman doesn't have even to be cut open for fibroid treatment. Right now people are being opened, and to see that was also pretty exciting for me, because I know a lot of women who have suffered going for fibroid treatments. They're left with big scars, but now you can be able to get your fibroids treated. And I've been fortunate enough to help. Once I saw it, I started shouting about it, and I've been able to help quite a few women get and access that treatment. There's also introduced the first PET MRI, I think, in the whole of Asia. A PET scan is one of the only machines that can detect cancer accurately. Now they've taken it to the next level and developed a PET MRI.
That's right.
And Apollo is one of the first in the whole of Asia to bring that on board.
Yes, and the advantage is that you can pick up even very small malignancies with cancers which you would miss otherwise with the PET scan. So it's a step further out in that direction. The other thing that's going to come up in a big way is gene therapy or nanotechnology.
Which is?
Nanotechnology is using certain viruses to get the repairman onto the cell, if I may just use the layman terminology. The cancer cell is in the prostate. How does the repairing team reach there? It has to have a vector, something to place it on and which will go there. So there are certain viruses which have been developed. You give it to the blood and it will go and stick onto the prostate gland. And there yes, the defective DNA is removed and the fresh DNA.
Siblings. One person can be able to treat things like bone marrow cancer. If they need a kidney, you just grow it instead of going to get a kidney donor. But I think that's for another time.
For another day.
Yes.
All right. As we end, any closing remarks?
Just that I've enjoyed my stay here in Kenya and wonderful people. It's been a very nice experience and I take back very sweet memories back to New Delhi.
Welcome again.
Pathway.
Thank you very much.
Pathway to close up. Pathway International is very excited and very passionate about bringing real change to Kenyans, allowing Kenyans to be able to access services that may not be locally available, allowing other people from the globe to come to Kenya and access services that may not be locally available in their destination. So we're very passionate and we're always searching for solutions for Kenyans. And one of them that we found that we thought we must share is the robotic surgery.
All right. Well, you have been watching a special edition of the MedFiles program. I hope you've learned something. I have been your host, Marianne Bogowaisha. Do join us next time.
Audio Jungle. Audio Jungle. Audio